As Zambia begins to experience what is seemingly the end of the second wave of the coronavirus pandemic, the number of critical patients remains high. National Director for Infectious Diseases in the Ministry of Health, Prof Lloyd Mulenga, says despite the huge reduction in the number of admissions, the cases of those in critical care continues to remain high.
We are looking at the absolute numbers. Let's talk about Levy. Critical patients are still the same. We have, of course, there's some reduction, but those that are in ICU, we have 12 in ICU. In fact, we have to create another bed space in that specific ICU, and they are critical, 14 total. And you look at the proportion of the patients that you have compared to how many you have as critical, and that ratio has been around 15 to 18%. That has not changed really. So the number of critical patients is still high, and more importantly when you compare to the number of patients that we have. The total number of patients in the facilities has reduced drastically, but those that are critical, the ratio is still high.
Professor Mulenga says the situation is different from the first wave, as now patients are presenting in critical condition and staying for longer periods of time in intensive care units.
So the ratios are still the same. Meaning that we'll still continue seeing some people that we may lose because they're still very, very sick. It's different from the other wave which we had, where we had mild symptoms still remaining in the facilities for the first wave. But for this, it's a very sick wave. Time in ICU has also been extended. We have a patient who stayed in ICU for 5 weeks, then on the general ward again for another week. And we discharged that patient yesterday. It was good news to see someone who has been in hospital for almost 7 weeks being discharged.
He says admission age ranges from 25 to 65 years. Virginia Chilongo, Movie TV News, Lusaka.